Abnormal respiratory responses in adults born prematurely. Definition: Perinatal hyperoxia in preterm infants is associated with several well-known sequelae, including bronchopulmonary dysplasia and retinopathy of prematurity. A premature infant is a baby born before 57 complete weeks of gestation, more than 3 weeks before the due date. Definition: Perinatal hyperoxia in preterm infants
My work
is
is basic
associated with
developmental research, but it also has an applied arm, and that applied arm is primarily focused on trying to develop an animal model that would help us better understand preterm human infant growth and development. Those weeks or months that they're spending in the neonatal intensive care unit, they're getting very different patterns of sensory experience than would normally happen if they had stayed in utero during that full gestation. We're really looking at how does prenatal experience spill over and affect postnatal development. We ended up working with bobwhite quail for probably
hyperoxia also induces alteration in cardiopulmonary content. It has not been determined whether this impairment diminishes with age. Thus, we sought to determine whether or not ventilatory dysfunction persists in adults who were born prematurely. The strong relationship between the hypoxic and hyperoxic ventilatory dysfunction in the preterm adult suggests a common impairment in chemoreceptor function that may be due to carotid
Chemoreceptors in the carotid and aortic bodies monitor blood oxygen, carbon dioxide, and pH. Impulses from these chemoreceptors are conducted to the control centers for heart and blood vessels via the glossopharyngeal and vagus nerves. Chemoreceptors in the medulla oblongata monitor blood carbon dioxide and pH. Decreased blood oxygen, increased carbon dioxide, or decreased pH decrease parasympathetic stimulation of the heart, which increases the heart rate. Decreased blood oxygen, increased carbon dioxide, and decreased pH increase sympathetic stimulation of the heart, which increases heart rate and stroke volume. Increased sympathetic stimulation of blood vessels increases vasoconstriction.
The strong relation. Abnormal ventilatory responses were manifested only when these preterm adults, who appeared to be clinical and normal. It was found that some preterm adults paradoxically hypoventilate with hypoxia.
Most of us take breathing for granted, but not everyone is that fortunate. Because of an accident or illness, some people need assistance to breathe. They may rely on respiratory therapists. These professionals have gone to college for at least an associate's degree to learn about respiratory illnesses, conditions that affect the lungs, such as asthma and emphysema. Therapists also learn how to treat people who are having trouble breathing because of an injury or stroke. Struggling to breathe can be frightening, so a calm, reassuring manner is essential. That includes taking the time to clearly explain procedures and answer questions.
I'm going to put you on this machine. This machine is going to help you with, okay?
Using a ventilator and breathing tube, the therapist delivers oxygen to a patient's lungs. They usually work under a doctor's supervision in hospitals and clinics, although some therapists visit patients through home care services. It's not unusual to work nights and weekends and spend a lot of time standing and bending. Tanks can be heavy, And because gas under high pressure can be hazardous, you must handle them with care. Much of this work.
Conclusion. Adults with a history of preterm birth have abnormal ventilatory responses to hypoxia and hyperoxia, possibly due to disrupted chemoreceptor development.